Did you know some of the things we come into contact with every day are potential items that could be poisonous? Things some of us adults may never consider to ingest may be items that young children or older adults with either medical conditions related to confusion or impaired vision could potentially ingest if not stored properly. Some of these items we see and use every day are our medications, over the counter, prescriptions, or even just our vitamins. Household cleaning products and detergent pods may be especially appealing to the children. Other potential household poisons include glues and paints, insect and weed killers, and car maintenance products. Every day in our routine, we use alcohol based products, but did you know if you consume them or ingest them, they could be potentially hazardous? Like our mouthwash, hand sanitizer, and I know all of you are using that right now, but just don't ingest. Nail polish remover, our perfume or cologne, and aftershave. So make sure you properly store all these items.
Reduces plaque, freshens breath. Wonder how much of this I got to drink.
Nitro, should we have some candy? Yeah, good candy. Oh, look at there. Look, we got candy. Oh, look at them big candy pills. You want one?
Main Street. We recognize the greater good. First and foremost, we have to protect the lives of our Nebraskans. And then we'll work together to ensure their livelihoods. On behalf of the businesses here in Nebraska, I want to express my heartfelt thanks and appreciation to Dr. Antone, the public health team here in the state of Nebraska, and the medical community in our state. You're doing an heroic job right now to keep.
As I mentioned earlier, young children and confused or vision impaired adults are at much higher risk for unintentional poisonings. There are just a few suggestions to follow if you're living with or taking care of individuals that fit into these categories. First, make sure all medications and household products are well out of reach. That means for children to store at higher locations and to make sure stored out of sight otherwise. Avoid putting purses and handbags at low places, which may contain hand sanitizers or medications for those curious children. A big no-no is to entice your children to take their medication or vitamins by calling it candy. Keep all medications and products in their original container to avoid any additional confusion. Children and older adults may try to consume items with fruit on the label, so be cautious when storing these items. Lastly, supervise these individuals closely in areas which are common places to store potential hazardous materials, like kitchens, bathrooms, and garages. Drug overdoses may be intentional or accidental. The drugs used may be either over the counter, which you can find at most grocery stores like Walmart and Target, or they may be prescription drugs, which you would receive from your pharmacy. Regardless, if you ever come across someone experiencing signs of a drug overdose, you should always call 911 immediately. Signs of a drug overdose include unresponsiveness, chest pains, difficulty breathing, vomiting of blood, a seizure, severe headache, slurred speech, and someone who becomes aggressive or uncooperative. While waiting for EMS, try to figure out what substances may have been taken by the individual and keep that person covered to minimize shock.
That
1 hour later. Drinking large quantities of alcohol over a short period of time may cause alcohol poisoning. A common term referred to today is called binge drinking. This is when a person's blood alcohol concentration is above 0.08%. This is often seen when a woman consumes 4 or more beverages in over 2 hours and 5 or more for a male. Because alcohol is a depressant, it slows down the central nervous system. Symptoms of alcohol poisoning are very similar to a drug overdose: unconsciousness, vomiting, seizures, hypothermia, and slow and irregular breathing. Again, if you suspect someone may be experiencing alcohol poisoning, call 911 immediately and place them into the recovery position to wait on EMS. Again, that is on one side with their arm closest to you extended above their head. You couldn't hear me or see me, could you? That's why they call carbon monoxide poisoning the silent killer, because you can't hear it, you can't see it, and you can't smell it. I've already spoken about the two other types of lethal poisoning, drug overdose and alcohol poisoning. The third type of lethal poisoning mentioned in our book is carbon monoxide poisoning. Carbon monoxide is produced when fuels are burned. This is not a problem with proper ventilation. However, if ventilation is faulty or the equipment is supposed to be ran outdoor and is running indoors, this could lead to toxic levels of carbon monoxide. Toxic levels of carbon monoxide lead to carbon monoxide poisoning, which can cause headaches, nausea and vomiting, drowsiness, dizziness, and confusion. Again, call 911 immediately if you suspect carbon monoxide poisoning and attempt to remove the individuals from the area and get them to fresh air, if you can do so without endangering yourself.